the next in the series of our 2011-2012 Faculty Development OWL program. Today we have Dr. Robert Shiel presenting on the opportunities, challenges, and support for EBP in the classroom. So I'd like to thank you all for coming. Thank Dr. Shiel for volunteering to lead this faculty discussion and do the presentation. And I'd like also to remind you that our next OWL is Dr. Robert Appleyard on Monday, June 25th. So thank you, Dr. Shiel.
Thanks for inviting me. And one of the things that Barb said that I think is key here is I do want this to be a discussion. And I think this whole idea of opportunities, challenges, and implementation of EBP ideas is something that we need to do together, and we need to brainstorm together and promote and share ideas to make work effectively. Last time I was part of one of these presentations, I was giving a description of my experiences in the classroom with the EBP projects I was asking students to do. And I kind of raised some of the issues that, interesting things that I had found happening that were challenges for me in the classroom in terms of getting students really involved and committed and really thinking about this as something they're going to do in practice, as opposed to an assignment that they had to get done in order to pass the class. And so I wanted to I've been thinking about that since, and what I'd like to do today is to talk about and raise this idea, how will we together move things from where we started a few years back and the development of individual courses and then trying to get EBP projects into the classroom and getting faculty to volunteer to put them into the classroom and start thinking about what's that next step to make evidence-based practice the ubiquitous thing that happens in the program, everywhere, all the time, and so that we have a philosophy of care. So, that was Dr. Kramer crying there about that. Okay, now, all of a sudden the remote's if you click the first one. Oh, click the first one. Okay, we're good. So, general theme here is this idea that evidence-based practice is a philosophy of care. It is a form of critical thinking, and it is all about case management. It is a way of managing our patients. It's something that we all need to bring to practice, and it's not defined by the individual courses we put together or the individual projects. Those are all nice pieces, but they are not really what our goal is. We're looking for something more. So the question for today is, how can we promote that philosophy of practice in all of the educational experiences that we give our students? How do we make that from its own little thing that we do into, like I said, this baseline of what's going on in the program? Can we click the mouse the first time? I'll hit the mouse and then back somewhere. So I wanted to define the challenge for us a little bit. And I looked at some of the literature out there on this. And I think this is part of the challenge is we need to challenge ourselves relative to these things. And in this first article that came out in '99, I thought it was interesting because they did this research with the docs, and they found that physicians kept saying, well, they're all positive about EBP. Everybody's positive about EBP and for its use in practice and all that stuff. But when we hit the ground running, what doctors do is something else. They still rely on personal experience. They still rely on the opinions of their colleagues and, discuss this with people that are expert. And they don't do much with EBP in terms of their decision-making and working with patients. And we don't use it much in the teaching that we do. We still rely on, this is what I know, I'm the expert knowing this stuff. And so one of the challenges is we need to think about how we employ evidence-based principles into who we are and how we operate, how we think about patients, and, in fact, how we run our classrooms. Not just as individual projects or asides, but how we run the classroom day to day. There was another article that was looking at this and why don't doctors do evidence-based practice? And interestingly, in this article they said, well, the major barrier that doctors saw was, gee, they didn't have the time to do it. That somehow this was a time problem. And I thought that was really interesting. I remember, it's got to be 20, 25 years ago, when the whole idea of patient-centered care and patient-centered interviewing came to the foreground. And at that time, doctors said, oh, well, yeah, that's a great idea, but we don't have time to do that. We're busy people. We've got to ask our questions. We've got to get the patients in and out. We've got to move on. And there was a lot of resistance to changing the way that doctors collected information from patients. But over the last 25 years, the data has been very clear on this, that when you shift to a patient-centered interviewing technique, actually, in the long term, in working with the patient, you actually spend less time with the patient overall and get better outcomes. So you're more efficient with your time and get better outcomes if you do that kind of approach. Yes, it's true that you have to change what you do. And maybe there's a little bit of added time in one way, but you're saving time someplace else. So overall, it's a savings. And I suspect that the same thing is true about evidence-based practice. People need to learn new skills. They need to implement. That certainly takes time. But if we do this, we're going to have more effective and more time-efficient practice with our patients. And I think that's one of the messages we need to buy into and to get across to our students, because again, it's like this as well. It's just other stuff I've got to do that they're keeping me from thinking about being a doctor. Making me do this other stuff. And then this article came out in 2004, which was a systematic review of the literature. They looked at a whole bunch of research on putting evidence-based medicine into these graduate professional programs. And they said, well, you know, the standalone courses don't work so well in terms of what you get when you measure things down the line. But what does seem to work is when you can integrate that stuff into what happens every day. And when you're expecting the students to, when they go from early on, they give them projects, but all the way through to when you expect them when they're in the clinic to use these principles and demonstrate them as they're working with patients. And they found that integrating it helps both appraisal skills, being able to do the technical parts of what's going on. It helped change the attitude that people had toward EBP, not as that separate thing, but as this is what I do. And ultimately, the behavioral changes that we're looking at only seem to come about if we integrated it into the curriculum rather than as separate individual courses or events. So the research is saying, yeah, if we don't, you know, we start out by putting it in pieces, but we've got to go someplace with that. One other article then that I looked at said that again, it's also about this idea of teaching it in a longitudinal fashion. It's got to be there every day. And in this study, what they did is they said, in this research, they said, well, they gave a 4-week program in EBP to first-year students. And students picked up the factual knowledge right away. They understood it. They could parrot it back on a test. They could answer test questions on it. And they were pretty good at actually understanding what it was all about. But without integrating it in a longitudinal way, there was no application of it, and there was no valuing of it in terms of it being a useful tool in providing health care. So they looked at that they started out with a small program and realized that what they needed to do is, again, have this longitudinally in what they did in terms of education. All right. So I think that's the challenge. How do we take what we're doing, all these great things that we're doing, all these interesting things that we're doing, and make them something that's a change in attitude and focus and orientation to everything that we do at the institution? And I started thinking about, I've been trying to think about this of late, because I started out thinking, hey, I was asked to put an EBP project into my class, and I thought, oh, that's a great idea. I'll put an EBP project into my class. And then I had one in my class, but I wasn't day-to-day doing all things to make evidence-based practice the baseline of how I was presenting the material. It was just this thing that I added on. And if students were taking it that way, I tried, and again, from the last presentation when I said, well, students are taking it that way, I was trying to be self-reflective and say, so what am I doing that encourages them to think about it that way, and can I change anything about what I do? So what I'd like to do today, then, is ask you to think about, and have us have a conversation about the different elements of evidence-based practice, and how do those pieces show up, or how could they show up in what we do day-to-day in working with our students. And so, of course, the 5 things are, from the 5 standard things we think about in terms of evidence-based practice are, can we ask a focused question? And I liked Center for Evidence-Based Medicine. I had this nice definition that it said, translating uncertainty into an answerable question. Being able to focus, who is this person and what's going on with them and what do I need to know? And how helpful that is. And again, I know that was one of the challenges I found when I was working with the project I would give students. They had a harder time with a PICO question than they had with anything else. What specifically do you want to, what specific question do you want to ask and investigate? To which they kind of said, well, how do I get a patient with X condition better? And of course, I would get so I put that in my search, and I got 1,800 hits, and I picked these 2 articles or 3 articles. I'd say, and how did you pick those 3 out of 1,800? You reviewed all 1,800, and these were the best? Yeah, no, I guess I didn't do that. So, random selection of articles is not exactly evidence-based practice, right? So, asking a focused question, and how do we challenge ourselves to make focused questions part of what we do? And then the systematic retrieval of evidence. How do we talk about that retrieval? How do we get students to participate in that and think that through on an ongoing basis? Part of that is technical skills. What are the searches that they can do? What are the words that they can use? But also just thinking through, connected with that focused question, what is it that I'm after? And then can they do, in the EBP classes, they learn about critical appraisal, how to weigh and balance and understand what the strengths and weaknesses are of an article and how, whether it holds water. Fourth, then, incorporating those into decision-making. Does this really apply to my patient? How can I make an application here? And then I think the 5th point, really interesting one, how do you audit what you're doing? Is it really working? I know that's always a big question in practice and something that's been an issue for us in technical ways here, even in our clinic. We develop problem lists, and do we ever retire our problem lists or make reviews on those problem lists in terms of reviewing the effectiveness of what we're doing, and how do we put evidence-based practice into those ideas? So the question is, where do we find these 5 steps in both our expectations of students and in the way that we teach? And so what I'd like to do is have that discussion. I thought I'd start out by just giving some examples of projects. When we were asked, a number of us were asked to put EBP projects into the classroom that we did, and we're very proud of to start out with, do these things. So ultimately, I asked students to do the best bets table for my psychopathology class. Pick a topic of interest to them in the field, a question that would come up of something that they have an interest in or anticipated seeing in practice, and ask that specific question. With an encouragement, although I didn't have any way, I did not follow up on this, are they making a search, and are they making that a permanent search? Are they setting that up so that not only are they searching one time for this assignment, but having something that's active that every time new articles come up, they're going to get their little email because they set up the permanent search through my NCBI, and now it's there for them to always keep them abreast of that information. And I try to talk about that to make that happen. This is not just this is an ongoing thing. So that's something that I did. Dr. Cohen was doing it in the special POPs class, and that actually got shifted over to be Dr. Curtin's class, and he's kept going what Dr. Cohen put together. Same thing, a bets table there that they had to fill out, topic of their choice in managing managing something in that area. And then in addition to that, Dr. Curtin has added in his E&M class in 5th try, E&M of extremities, several case studies where what he'll do is present a case. They will talk about the case and share ideas from what they learned in class, and then he will challenge them. And he will have done a review of the literature. He'll have looked for best evidence. He'll challenge the students to do that, and then he'll present his best evidence that he's found in the literature for how to proceed with the case. And so he's making the whole process for how he would work with the patient explicit. He's got several cases that he's using in his class that he's presenting that way, which was very cool. When he told me that he was doing that, I thought that generated some ideas for me in terms of what I might try to do. Dr. Cohen, when he was in charge of clinical natural medicine, asked students to do literature reviews about current techniques and the state of affairs of the research behind the effectiveness of the technique. Okay, we do this, we talk about this. What's the state of the literature on this? So how strong are you, and how well can you argue the point for this approach, which is another thing going out. Dr. Cohen was also asking students, all right, you're going to do this. How do you take that information and turn it into patient education? How do you do it, create like kind of public education seminars for students? How do we go out, or for the population, how do we go out and make these things, go out and give a talk to different community groups that talks about here's the state of where things are and what we do, which I thought was really interesting. And part of what he was doing there is saying, not just the technical literature, but he's asking students also, go find the popular literature and how are they interpreting or talking about what the research says. Because now he's saying, let's take it that extra steps. Patients are out there reading all this popular stuff. Do we know how the popular literature is interpreting what the research is saying? And if we're going to do patient education or make presentations in public forums, we need to be aware of that and kind of tie those two things together. Here's what they said, but here's what it really means, be able to be that fluent with the material, which I thought was really exciting and interesting. And then Dr. Richardson has been doing a thing in his pharmacology class where he's asking students to pull together both what's in textbooks, textbook and article, and kind of pull from a variety of sources, and not a literature review, but just pull things from a variety of sources and try and pull it together and make a case for a particular approach or treatment. So these are some of the things that have been going on, and I really appreciate when I put this slide together, I asked these folks, could you just remind me of all the things that you were doing, give me a little review of where that is and how that's going, and so I appreciate that they all got back to me and we kind of pulled this slide together. So those are some of the things we've been doing, taking it beyond all the stuff that's been going on in the class, in the EBP courses themselves. So now I want to start a conversation with you. And on those 5 different elements of evidence-based practice, what are some of the ways that we can think about what's going on? And so here's some questions that I came up with, and maybe you can come up with others. But if we're thinking about asking a focused question, where does asking the focused question come into play every day in our classroom when we're teaching students, whether it's an ology class or whether it's a laboratory? And I think in particular, the questions that came to my mind, how do we use literature to address uncertainty? As say, most of the time we're trying to figure out what is the thing to do here, right? We're uncertain about how to proceed, how to go forward, what's the state of care here, and the question is, how do we deal with that? How do we talk about it? I know that students are asking me all the time, well, what about this, what about that? And I'm often saying, well, I've not seen any literature on that. And then the student said, yeah, I did a search and I didn't find anything. And I'm thinking, well, glad I didn't miss something. And I said, but it's an interesting question. That oftentimes they're trying to pull, what about this? Is it related to that? And so where is the uncertainty? How do we bring that up? We often, I think, present material as we're the pros, we know what's going on, we have all the answers. And we promote the idea of the expert. And I think one of the things about that is it promotes, I think there's a danger that as we present ourselves as the experts, which we have to do in some sense, but if we get too caught up in that role, I think we make our students passive in their learning. You tell me what I need to do. And the question is, how do we say, well, here's the limits of what we know. Where do we go from here? How do we pull this together? How would you pull it together? For me to be able to say, how would I pull it together and take it actually? Where is the next step of what needs to happen? So I think that idea is really an important one, recognizing that if we're not able to address and talk about the uncertainty, then how do we expect our students to become active in their learning? Again, because they're going to go, well, I'll go to the expert who will tell me what to do. And which is, again, as my earlier slide, that's what doctors do in practice. Well, I don't know this, I'll go ask the expert. They get the consultation. And I'm not talking against the consultation, but that you're not pushing yourself to do the best in practice and keep up with the literature if you're operating that way. So I don't know, so kind of connected to that, I asked the question, where do different opinions reside? And how do we address those in the classroom and in the literature? How do we identify what's still unknown? Where's the next research coming from? Going to be about? Where is it coming from? What are the questions that need to be answered? And then simply, how do we provide direction or examples to students in formulating focused SPICO questions? So these are just some thoughts I had. I'm wondering where everyone else is just in thinking about this idea in terms of how you present things to students. Ryan.
So I'll give you a clinical scenario that just happened yesterday, which kind of ties in with this pretty nicely. So a patient presented to the clinic here yesterday, and her chief complaint was fungal toenails. Okay? She had researched somewhere that laser therapy could be helpful for fungal toenails. She had tried a whole range of home remedies and treatments without any success. So her question to us was, does laser therapy help with fungal toenails? So the intern comes back to me and asks me that question, and I say, I have no earthly clue if that's helpful or not. So the challenge clinically is, how do we answer that question to the patient when they're sitting right in front of you? You don't have a half an hour to do a literature search and develop a PICO question and do all this stuff. So, the I guess main challenge is, where is the patient getting their information from, and how accurate or relevant is it, right? If they're doing a Google search,
right,
and they're looking on forums, people who've tried it in the past or whatever. So, coming up with a quick answer to that question is something I find kind of challenging. And how do you address that clinical scenario as it comes up immediately, right? Because we can always do, after the patient leaves or the next day, overnight, I can have the intern go home and research that clinical question in PubMed or using actual published literature. But a lot of times there's uncertainty in these clinical scenarios that we have the knowledge on how to answer their question, but it's not something that's readily available at your fingertips. So
right,
that's just a challenge I have in the clinic, is how to deal with situations.
It's a great example. The kind of thing that happens all the time is that, and the same thing happens in the classroom. The students will ask me some question that's like, what about this treatment? And I'm like, well, it's maybe not a standard treatment, not even one that I'm familiar with. And I have to stand up in front of the classroom and say, well, I don't know that one. And I'll tell you that I had in the classroom I had a similar experience a couple of semesters ago, where a student asked that question. I said, well, that's a great question. I don't know the answer. You could look it up. And I talked briefly about how we could do that. It was an end of week class. And of course, I went home that weekend. I'm thinking, I told them they could look it up. I could look it up. And it turns out I was visiting my daughter and my grandchildren for the weekend. And literally, I had tucked them into bed and, done all this, and my daughter wasn't sleeping, and I was sitting up, and I pulled out her computer, and I started doing the search, and I found this thing. And so I went back in on Monday morning. I said, well, over the weekend, I was visiting my grandchildren, and they all looked at me like, well, I had two heads, like, what, are you nuts? You're visiting your grandchildren, and you're doing this search at the same, why would you be doing that then? And it didn't occur to me until I told the story that, well, I'm coming across like a real geek here.
We're used to it, Bob.
Yeah, but part of it is I also wanted to say, look, this is not something you can go look. You can find the time. It didn't take me that long to go through and start doing at least a preliminary search and find some really interesting stuff early on.
Give me enough time, I could go through the literature and give you a more confident answer.
Yeah, exactly. That's what I had the intern talk to her about, which is this is not something we deal with on a regular basis, so we'd like to take a look and see what the research says about it. In the meantime, we can try it. There's no harm in trying laser for your fungal toenails. I can't tell you how effective it's going to be.
Until we take a look and come back.
So why not try it?
What prompted that is an advertising campaign that's has been running for over a year by some chiropractors promoting the use of laser therapy for fungus. So I'm sure that's what you picked up on the radio constantly.
I haven't heard that.
Yeah.
You know,
Last year.
one other thing that I know that when I was thinking about this, when you talk about one thing that's possible, kind of quick search is I can't think of the Cochrane site database where right. So they so you can jump to Cochrane and type in fungal toenail laser, and maybe they've done a review on it already at Cochrane, and there it is, and you can, because they'll give you they'll give you the summary, in a paragraph, and you can go back and say, well, the general review is saying X, Y, and Z, but we're, and give them some information and say, but we're going to look into this more closely and, and look at, go into more depth about what individual research has shown. So there is a quick way going to someplace like Cochrane to pull that stuff up. And it's, it's something that I haven't used in the classroom, and I've thought about getting to certain points in my presentation and asking the question, having looked ahead, of course, to see if it's there, and say, let's look at Cochrane, and push the button, and there it is, and say, well, that didn't take long to get us going.
What I found with Cochrane, I don't know if anyone else agrees with this or not, is in general for CAM therapies, the outcomes are terrible.
Yes.
They never support them, almost never, because
right.
they don't, the type of studies that they want to incorporate into these Cochrane reviews is not the type of study generally that's done in CAM therapies. So they have to cherry pick and take a very limited number of studies to review, and they generally say it's inconclusive or something
or
like that.
If the original study is asked from the allopathic or from the the non-CAM viewpoint, then the only thing you can do is they search to prove the null hypothesis, and so all they can really conclude is how they ask the question. So if they didn't say, is this specific chiropractic technique more effective than surgery for this particular problem? If they don't ask it that way, you can't come up with an answer that way and have it be valid. And that's one of the things that most of the Cochrane reviews would point out, is we had to eliminate all these studies that were pretty good because they're, the question that they ask doesn't fit with these, therefore we can't combine the results.
Yeah. And I didn't mean to promote Cochrane as necessarily the best. That's just one example of a source, but it leads to it. There's several other places to go that we can do this, but it also leads to a question that I've had for some time. Where is it? Is there a good place? Where are the good places for CAM summaries that have been written? And the extrapolation I have is, if we are asking our students on a regular basis to do these summaries, and if we are having faculty interested in working with patients and doing these summaries, how come we're not compiling that database of those summaries, especially if no one else is, at least to the degree that we're happy with? And I know that, Best Bets, I think, maybe does a nicer job than Cochrane in terms of CAM stuff. But there's, I don't put myself out there as an expert of knowing where all the sources are. But I think that's an interesting question of, do we all have a good sense of what's out there? Are we sharing those ideas with students and with each other about what kind of databases are there that have have done this work for us to streamline what we do in practice and show students to do in practice. And again, if it's not there, couldn't we as an institution begin to implement that? And so, excuse me for going off on one of my little soapboxes. If I go pretty much farther, I'll start talking about the quarter system. We're having students generate all of these different things in all these classes. Everybody's doing, how many different places do we have students pulling together and doing a bets table? And what happens to all that? It's not accumulated knowledge that we're creating with that. And it seems to me one of the points of doing evidence-based practice is accumulating knowledge and making that available. Right.
Yeah.
And so I don't think.
Retrieve manner.
So I think one of the ways that we're failing in terms of the education that we do is we're not providing ways of making the work that students do available. And I'm not suggesting that the work all the students do is the kind of stuff we put a stamp on and say, yeah, follow this logic, because that's not the case. The best ones certainly do an excellent job. But I would also think that when, even if what we had was a review process where faculty would take the best ones that pass some scrutiny and muster, and we post them somehow in an organized way, would be awfully interesting, I think. So those are just, of course, that's just the thought that passes through my head, saying, wouldn't that be a fun project? And if I know Dr. Kramer can get the $1 million or so that it would take to make that work in some grant. But anyway, that's certainly an idea.
I was thinking that, well, we were asked to find out how much it would cost to provide databases for the alumni here. The one that cost us $590, something like that, which is the natural medicine comprehensive database. That goes up to about $4,000 for a graduate. So I'm thinking, okay, what can you do that these students are going to get used to doing that they're going to be financially able to do after they graduate?
Well, I know that's certainly true, and I know that the whole idea of having something that goes public and is out on, that people have access to from the outside is a daunting task and a big one, and we don't even have the bandwidth to do what we're doing now, let alone create something like that where we get thousands of hits from the outside on a website like that. But the question I have is on a small scale, what can we do internally in terms of, bottom line is, for most of us, the students submit those papers on Signet, and we read them electronically, and then come the end of the semester, the IT department magically pushes a button, and it's all erased so that we can start over. But just the process of how do we take some of that stuff and start to accumulate it is a daunting task. But are there, I guess what I would ask is, are there ways and pockets that we might be able to do it a little bit? Just like we started out, can we even talk about or have projects for EBP in the classroom a little bit?
Right.
A couple of years ago, we weren't doing any of the stuff in the classroom, and we started out by implementing a project here and a project there. So, having making those kind of things, how do we take doing that and say that it has value? And one of the ways we say that it has value is we put it out there for people to look at and say, here it is. Your classmate did this. What do you see? And again, but with some review, obviously. So anyway, those are some ideas. Any other ideas about focused question?
I have one for Brian, and if you would, maybe if you suggest to your, so everything you've done is, perfect, and you're handling it the best way, but I was thinking when those come up, just kind of having in the back of your mind to suggest that to students for a journal club, and this would be a good topic for a journal club. And so then if they search the literature and they present the best paper they get, then next time this question comes around, you can really kind of build the soil and gotten the best thing. Good idea.
Well, one of the things I thought about also, what stimulates my thinking, Greg, when you say that, is could we, for example, take some of these bet tables and other things that students are producing, put them out in some form, and then ask the more advanced students, 8th try or when they're journal club or whatever, you take these, critique these, polish these to put them, to put someplace. So get students to work on, or go back to your own thing and fix it and polish it and take it someplace. So
it's kind of where the elective came in that we were at last workshop. Remember that group?
Pulling a group is the group of the most motivated students together, the ones that would like to take that as an elective, and have them.
Okay, here's what's happened. Here's what's happened in Dr. Shiel's classes. That they have now. We'd like to take it to the next level.
And I think again, that's obviously ultimately we'd like everybody to be doing that, but we have a whole long history of courses that started out as electives that became part of the core curriculum over time, and we need to find some workable way to start it. If you start too big, you kind of collapse under your own weight. So having something that we can start with that, make it happen in a little way. And I think I think if students in an elective started to do that, and that material became public inside the university, that students internally on the website could gain access to it, that would be something, moving on, I'm going to get to this briefly to, Frank.
Do I have time to brief the group on our project?
Well, I've got 3 minutes to cover 4 slides, so maybe we could hold off. One of the questions when we think about finding the evidence, and we've been touching on this, where do students construct, share, and discuss these clinical questions? How do we put that stuff out there, and not just inside a structured classroom setting? But how do we make it out there for students to use? One of the things I try to utilize from time to time is how do you get the natural thing that students do outside the classroom? How do you make that part of the curriculum? And I know it's interesting. A silly little thing that I do in my class is when I give quizzes, I will sometimes at the end of the quiz say, all right, now you have 3 minutes to talk to anyone else about your answers. And if you want to see enthusiasm generated in the classroom and excitement and discussion and activity, man, they go and they have these debates and conversations and everything, and getting that in. But of course, all I'm trying to do is capture what they would have done right after class. If they turn the quiz in, they're going to go out in the hall, and what's the first thing they're going to do in the hallway? What you put down for number 3, right? So I'm saying, well, instead of just doing it out there, do it in here and write it down. And actually, since I've started doing that, I find that student retention has gone up. So, they don't always get to do that with the quiz, but doing the quizzes helps keep them up to date. But getting them to actively ask each other and talk about, what do we know about this? I think this, you think that. This is what I remember. And finding a way to do that with research and with the evidence is something that we, how do we capture ways to make that happen is my question for finding the evidence.
Drinking game to me.
There we go. Dr. Kramer, going back to his college days, is going to turn that into a drinking game. All right, with something with ping pong balls and beer and the research. All right. Then critical appraisal. Do we, we expect them to do that, then how do we model that in different places from the clinic and down in to be able to say, well, here are the strengths and weaknesses of this. When I looked at that article, I found this, that, and the other thing. And where am I convinced and where's my skepticism relative to the literature? And I think part of the critical appraisal is teaching students and promoting for students how do you read what's there, how do you make sense out of it, and then how do you integrate that or compare that against what you know and what you've been taught. How do you pull all those things together? What you've been, the expertise from other people and what the literature is saying, and how do you make sense out of all that and appraise it? And where are the places that we're giving examples of that and asking students to do that and building structured ways to make that happen. When it comes to decision making, I think both the decision-making issues, we can talk about those in the classroom. Here's what I would do at this point. Here's where the literature says works. I would go down and do this road, X, Y, Z. So we can talk about that. And, part of that is citing the literature in the classroom and saying, here's the review, here's what it says, this is a decision that this is a reasonable process with these patients at this time, with this as an adjunct or as a this or combined with or whatever, to be able to have that conversation. And not just because I'm the expert, but here's what I found that caused me to decide this. So make that process, that decision-making process, explicit to the students, not implicit. Not that's the thing that goes on inside the expert's head, and then they just tell us what to do. And again, it goes back to that challenge, which is what doctors do in practice, is they know what they know, and they ask the experts about it, and, gee, it takes too much time to do anything else. So when it comes to treatment planning, when it comes to community outreach, thinking back to Dr. Cohen's thing of sending students out into the community, we've already talked about, if we talk about putting things up on an institutional website where we make those ideas open for conversation and make the information available. I think that's important. And then finally, this to me was kind of an interesting challenge. How do we evaluate what we're doing using this, the outcomes that we're getting? How are we evaluating the outcomes? We often get to the point of talking about, here's what we found works in care. But nothing works all the time. And the question of how do we go back and talk about how far do you go, when do you stop, how do you reevaluate that? Is it working? What else do we need to add? What other question do we need to ask to be effective with this patient? How do we do reevaluations? It's easy. I find it's easy in the classroom to talk about my successes as a therapist, but I'm trying to challenge myself to say, so when were the times when what you did wasn't working and you needed to challenge yourself in terms of approach and techniques of what's available in the literature and change directions? And how did I go about that, and how do I make that process clear to the students that they can, and I think that it's not just in terms of treatment protocols, but also in terms of diagnosis. One of the things I know we find our students very good at is they love to play the diagnosis game. What's the answer? And they come up with an answer, and they go, I'm done. I got an answer. And when you want to know, but what if that's not the right answer? And they go, I don't know. I don't need to think about that because I have an answer. And when you ask them to say, what are your differentials? What are you putting on the top of your list and you're going to address? And if that doesn't work out, what's next? How do you rethink what's going on diagnostically? This is a real challenge for our students. And, you know, how do we go into that process? How do we use the literature and evidence-based practice to get through that process with our students as well? I think is important.
Almost goes back to asking the clinical question and then re-asking it maybe from a different point of view.
Exactly. You're back asking another PICO question.
Right.
Given that this didn't work, what next is a whole different question.
Right.
And going back and starting that process again. I see that we are short on time. That was my last slide. What I hope comes out of this is that my hope is that we actually talk more about what we're doing in our classes and share the ideas more with each other to take this someplace. So that, again, we can make that transition from here we've got these projects that we do for students to this is the philosophy of how we approach our students and our classes and the education with what we're doing. So thanks for coming out. Thanks for eating the pizza. And thanks for coming in from Florida and Colorado.
No problem. Thanks very much.
Thank you so much, Bob. That was really interesting.
Comment, just to follow up on what Bob just said. We can continue this kind of discussion, and if you're interested in participating or leading, or if you want to lead another discussion and open with that comment, we can, we're scheduling the Fall Owl series, and we want to continue this whole theme of building evidence for CAM in educational research and clinical research and basic science research and in scholarly activity. So we're going to continue this same theme because everybody seems very receptive to it and utilize a lot of the resources. So just give me a call or drop me an email and say, hey, I'd like to volunteer to lead a faculty discussion or re-lead a faculty discussion, and you guys can participate. Thank you.
Okay. Thank you all.
That was great, Bob. That was good modeling of the EBP. It is.
Bye, everybody.
Bye. Thank you.
Bye, Louise. See you soon.
Yeah, see you on the 18th.